This next group of drugs are kind of a subtype of the estrogen modifying drugs. These are the ER or estrogen receptor downregulators. And really the drug of choice here is fulvestrant. This is also known as a selective estrogen receptor downregulator, or a SERD. And this is essentially an estrogen receptor antagonist. There's really no efficacy at the site of the receptor. This is in contrast to the previous group of drugs, the SERMs, which are partial agonists, and there obviously is some efficacy at the receptor level. From a mechanistic standpoint, this drug is a steroid-like compound that competitively binds to the estrogen receptor, and it blocks its ability to become activated. So over time, this results in estrogen receptor downregulation. This drug has more affinity than tamoxifen to the estrogen receptor in terms of probably 100-fold. And because it's an antagonist, there's no agonist activity at all. And it completely inhibits tumor growth and proliferation. You see a dramatic reduction in estrogen receptor-mediated signaling events. And then, interestingly, upon binding, it actually targets the receptor itself for degradation. Other clinical notes about fulvestrant include a monthly intramuscle injection with a really long half-life, over a month. This is a CYP3A4 substrate, and there are other reactions that are extensively metabolized through different liver biotransformation enzymes. Clinically, this is used for breast cancer, obviously hormone receptor positive breast cancers, with metastasis in postmenopausal women, typically after tamoxifen therapy. The adverse effects include injection site pain, hot flashes, headache, muscle ache, as well as itchiness and angioedema. And this is kind of a nice summary diagram looking at the different mechanistic attributes between SERMs and ERDRs, or Serds, either way. Do understand or do remember that when we talk about SERM pharmacology, we're talking about a partially inactivated transcript. And so because it's a partial agonist in certain tissues, you do get to see some genomic alterations due to estrogen receptor activity. This is in complete contrast to this drug group called Serds, where you actually see no transcription at all. So there's absolutely no tumor cell division, and then there's no recruitment of some of the genomic components at the estrogen response sites within the DNA. So these are just two different drug classes, each targeting the estrogen receptor activity. So the next group of drugs now that we're going to talk about are a group of drugs that inhibit the production of estrogen, whereas these are at of course, the receptor level.